We often think our mouths are, you know, separate from everything else, don't we?
Yeah, like a tooth problem is just
Well,
a tooth problem.
exactly. But what if that's not really the full story? What if what's happening orally is uh, deeply connected to our systemic health?
It really is fascinating.
Ugh.
Oral health isn't this isolated thing.
Mhm.
So many systemic conditions show up in the mouth, and, well, it can go the other way, too. The body's just so linked up.
Absolutely. And to really get into this, we're looking at a pre-proof article today. It's from the Journal of Dentistry.
Right, the one titled Impact of Diabetes Mellitus on Periapical, Periodontal, and Oral Health and the Potential Confounders, a cross-sectional study.
That's the one. So our aim here is to pull out the key insights from this research. Specifically, what does this actually mean for dental professionals? For their patient care?
Yeah, it's a really useful study. It gives us a snapshot, basically. They looked at 520 patients, age 20 and up. This was back in July 2021.
And they all had panoramic x-rays, those big ones showing the whole mouth.
That's right. And crucially, their diabetes status was documented, whether they had diabetes mellitus or DM or not.
Okay, so the researchers compared the groups and looked at some key oral health markers,
Exactly. Things like the DMFT index.
which is decayed, missing, and filled teeth, right? Kind of a lifetime score of dental issues.
Precisely. Tells you about the cumulative impact. And they also assessed periodontal health, looking at bone loss around the teeth,
Okay.
and periapical health, too. So issues right at the root tips, like apical periodontitis, using something called the periapical index, or PAI.
Got it. And they didn't just stop there. They looked at other factors, too.
Right, the potential confounders, things that might muddy the waters,
Like what?
Well, sociodemographic stuff, age, gender, education level, but also lifestyle behaviors like drinking alcohol,
Mm-hmm.
chewing betel quid, and smoking.
Okay, so they tried to isolate the effect of diabetes itself. Smart. So let's dive in. What were the really big findings? What should dentists take away from this?
Well, one of the first big things was the DMFT index. Patients with diabetes had a statistically higher DMFT score compared to those without. Significantly higher.
Higher DMFT, so more decay, more missing teeth, more fillings overall.
Exactly. So the clinical implication here, dentists really should anticipate this. When a patient with diabetes walks in, there's a higher likelihood of a more complex dental history.
Right. So don't just look at the immediate problem. You need to dig a bit deeper into their past dental health.
Precisely. A really comprehensive assessment is key. You're looking at their whole oral health journey.
Makes sense. Now, what about gum disease? That link between diabetes and periodontal issues comes up a lot.
It does, and this study really reinforces it. They found that having diabetes increased the risk of developing periodontal disease by almost 3 times.
Wow, 3 times.
Yeah, 2.97 times to be exact. And that was statistically significant based on bone loss seen on those panoramic x-rays. They used a cutoff of losing bone down 1/3 of the root length.
Okay, that's not a small increase at all, nearly threefold. So for dentists, what does that mean in practice?
It just hammers home how important meticulous periodontal exams are for these patients. You really need to be vigilant.
Looking for those early signs?
Absolutely. Looking for early signs, assessing their risk properly, and then tailoring preventive strategies and treatments. Yeah, it's a higher risk group, so the approach needs to reflect that.
Right, more proactive care, essentially. Okay, what about the other thing you mentioned, the issues at the root tips? Periapical conditions.
Yes, that was another significant link. The study found patients with diabetes had a 1.76 times greater risk of having apical periodontitis.
Okay.
That's indicated by a PAI score of 3 or more, suggesting inflammation down there. And interestingly, this applied whether the tooth had had a root canal or not.
So even in teeth that seem okay on the surface or have already been treated.
Exactly. Even if the patient isn't reporting any pain, there could be underlying inflammation at the root tip in diabetic patients.
So dentists need a higher index of suspicion for these problems in their patients with diabetes, even without obvious symptoms.
That's the key takeaway. Heightened suspicion is warranted. Panoramics are a decent screening tool here, but you might need those smaller, more detailed periapical x-rays to really see what's going on sometimes.
Okay.
And another thing to consider is healing. Periapical healing might be slower or compromised in this population.
Good point. This is all really practical stuff. Now, you mentioned those confounders' earlier lifestyle habits. How did they fit into the picture?
Well, they were definitely influencing things. The study identified alcohol use, betel quid chewing, and smoking as factors that affected the relationship between diabetes and oral health.
So it's not just the diabetes in isolation.
Right. These other behaviors also play a pretty significant role in the oral health outcomes for these patients. It means dentists need a thorough medical and social history. Asking about these habits is important.
Okay, so teasing apart the effects. Did they find any specific links, say, with smoking?
They did find something interesting with smoking. After adjusting for age, smokers actually had significantly more decayed teeth.
Okay, that makes sense.
But interestingly, fewer filled teeth.
Fewer fillings? That seems counterintuitive if they have more decay.
It is a bit curious, isn't it? The researchers suggest this might point to differences in maybe oral health awareness or perhaps access to dental care among smokers with diabetes.
Ah, okay. So maybe they're not getting the decay treated as often.
That could be one interpretation.
Yeah.
It really just reinforces how important it is to push preventive care and regular checkups for everyone with diabetes, but perhaps especially smokers. And counseling on quitting smoking, obviously.
Makes sense. Now, age seems like it would be a huge factor in just general wear and tear on teeth. How did that play out?
Oh, absolutely. You're spot on. Age was actually the strongest predictor for the DMFT index. It explained about 35% of the variation.
35%. Wow, that's substantial.
It really is. Age was also a significant predictor for the number of teeth with apical periodontitis, though it explained less of the variance there, about 5%.
So while diabetes is clearly a major risk factor,
You absolutely have to consider the patient's age and their cumulative oral health history over time. Treatment planning needs to account for both.
so the longer you've lived, the higher the DMFT score is likely to be, and diabetes just adds to that.
That's a good way to put it. It's the cumulative impact of time, definitely amplified by the presence of diabetes.
Okay. And did they notice any differences between men and women with diabetes?
Yes, they did.
Yeah.
After adjusting for age, they found that females tended to have more filled teeth and also a higher overall DMFT index compared to males with diabetes.
Interesting. Any thoughts on why? Did the study explore that?
No, the study didn't really delve into the reasons why, it just reported the finding. But it's something for dentists to be aware of these potential gender-related trends within the diabetic population.
Huh. It really sounds like a complex interplay of factors.
It absolutely is. And they did the sensitivity analysis too, which basically checks how much the results change if you tweak the statistical model.
Right. To see how robust the findings are.
Exactly. And that analysis suggested that gender, age, alcohol, betel quid, and smoking could all potentially be confounders. They could influence the size of the differences seen between those with and without diabetes for things like decay, missing teeth, filled teeth, DMFT, and apical periodontitis.
So all those factors we discussed really do matter.
Yes, the analysis indicated they could shift the mean differences by more than 10% in some cases when adjusted for. It just reinforces the need for that holistic view.
Seeing the whole patient, not just the diabetes diagnosis.
Precisely. You need to consider that interplay of all these different factors.
And the article itself summed this up quite neatly, didn't it? With a clinical significance statement.
It did. They stated it very clearly. Periodontitis, apical periodontitis, oral health status, and demographic and lifestyle factors show a strong association with DM.
Short, sweet, and to the point. Really highlights why this matters for dentists day to day.
Exactly. It's the bottom line for clinical practice.
Now, we should probably touch on the limitations. No study is perfect, right?
That's always important context.
Yeah.
And yes, this study had some. For instance, using panoramic x-rays, they're great for an overview, but they don't have the same fine detail as those little periapical ones for diagnosing specific issues, especially early ones.
Okay. What else?
Well, the exams were done by different specialists. They did check for consistency, for reliability, but it's something to note. Also, they didn't really capture the severity of the diabetes or how well it was controlled, like HbA1c levels.
Ah, right. Good control versus poor control could make a difference.
Potentially, yes.
Yeah.
And similarly, they didn't quantify the lifestyle habits, like how much alcohol or how often someone smoked. Other things weren't included either, like access to care or specific dietary patterns.
And it's a cross-sectional study, meaning a snapshot in time.
Exactly. So it shows associations, strong ones, but we can't definitively prove cause and effect from this design alone. Did the diabetes cause the worse oral health, or are they just linked? This study suggests a strong link, building on other evidence, but can't prove causation by itself.
And it was done in Taiwan, so maybe regional factors could play a role.
Yes, that's a potential limitation too. The findings might not be universally applicable without further research in other populations.
So valuable insights, but also points towards areas for more research.
Absolutely. More research could look deeper into causality, control levels, different populations, plenty more to explore.
Okay, so let's bring this all together. What's the core message, the main takeaway from our deep dive into this Journal of Dentistry article, especially for the dental professionals listening?
I think the central point is that this research really solidifies the significant impact diabetes has across the board in oral health. We're talking more caries experience over a lifetime, much higher risk for gum disease, and more infections at the root tips.
It's not just one thing, it's multiple areas.
Exactly. So for dentists, the big takeaway is you have to go beyond just treating the immediate problem when your patient has diabetes. You need a comprehensive approach.
Thinking about their systemic health, their lifestyle, their age.
All of it. That's what leads to informed clinical decisions, better treatment planning, and ultimately better care and potentially better overall well-being for these patients.
It really paints a clear picture of that mouth-body connection and gives dentists some really concrete things to consider. So maybe a final thought for everyone listening. How can you integrate these findings into your daily practice?
Yeah, how can dentists proactively use this information to manage the oral health of patients with diabetes even more effectively?
And what other questions does this raise for you about this really complex interplay between systemic health and what happens in the mouth? Definitely some important things to reflect on.